Toward the beginning of the whole quarantine and everything else, there was a ton of talk about testing and the need for testing and the availability for testing, and really holding back testing on the general population. And a lot of that was due to tests weren't available. Now tests are becoming more available and more possible to a lot more people. When you were describing things that potentially make for higher risk employees, how does that work kind of within your program to flag the potential risk and then get them the step to actually get them to the testing that might be very beneficial for both the employee and the employer to know?
So, when this all started developing 2 months ago, we had a flood of antibody testing, coming across with these finger stick antibody tests. And over time, we realized that a lot of them were flawed. A lot of them, their specificity and sensitivity were not great, and it wasn't working. And number two, we didn't even know what to do with the results. And by the way, we still are not clear of whether if someone tests positive for antibodies, whether truly they're immune. They probably have some level of immunity, and we're not even sure for what length of time that immunity exists. So the idea of testing positive for antibodies and then taking off the mask and not practicing social distancing is really not what happens when you do test positive for antibodies. With that being said, I don't, look, I understand from a public health point of view, screening mass people to get an idea of penetration rates. But when you talk about an employer pool of employees, testing asymptomatic people, the positive predictive value of a swab or even an antibody test is about 50%. So what happens is, by just taking an asymptomatic employee that really shouldn't be tested and saying, we're just going to antibody test everybody, we're just going to swab, do a PCR swab on everybody, you're going to create a lot of stress and anxiety within your employee pool, and you're really not going to know what to do with the results. So in my opinion, the right thing to do is targeted PCR swabs and targeted antibody testing. So testing people that really need to be tested. Also, for a lot of employee pools that do have health insurance, once you wrap an algorithm that says they need a test with a televisit from a board certified physician, insurance will cover those tests. On the other hand, if you just test the whole population, insurance is not going to cover those tests, and either the employee is going to bear that burden or the employer is going to bear that burden, and the employer may not want to bear that expensive burden, and the employee is not going to want to bear that burden, and then the tests are not going to be very reliable. So our approach is more of an algorithmic-based, targeted approach with board certified physicians, televisits, and I think that is.
I think that's the missing piece for a lot of people is essentially we need a doctor to tell us we need a test, right?
Yes.
And in order to do that, you need to visit a doctor, and no one wants to visit a doctor. So that telehealth piece seems like it is critically important at this juncture.